How would you feel if a diagnosis is followed by stigma and judgment instead of love and care? What if the people around you blame you for the illness? What if you are refused treatment? This is the reality for nearly 25 lakh people living with HIV in India, PLHIV. Many face refusal from hospitals to treat them, stigma that isolates them, a daily fight to stay alive and be seen as human. This isn't just about health, it's an empathy crisis. But change is possible, and INP Plus is leading the way. Founded in 1997, the Indian Network for People Living with HIV or AIDS, INP Plus is a national federation of 73 South Indian community-based organizations, or CBOs. Headquartered in Chennai, Tamil Nadu, INP Plus works relentlessly to enhance the quality of life for PLHIV by providing them with a sense of belonging and purpose and health support, thereby empowering them to take charge of their life. While many NGOs have worked in silos for years, INP Plus unites these efforts. They create a platform for sharing best practices, advocating for rights, and building collective strength.
Our vision is we want to see free from stigma and discrimination of people who are living with HIV, and they have to get free drugs for living quality of life. That I am seeing now, the government of India giving free of drugs for HIV positive people and living and leading a normal life.
INP Plus goes beyond support. They drive systemic change through research on cancer knowledge and barriers to treatment among PLHIV, capacity building and governance training for member organizations, advocacy for HIV, PNC, Act implementation, non-communicable disease prevention, and social inclusion.
వాళ్ళు కూడా లైవ్లీవుడ్ ఇన్కమ్ జనరేషన్ సోర్స్ కింద ఎవరైతే యంగ్ విమెన్ విడోస్ ఉన్నారో చాలామంది వాళ్ళకి మేము ఇన్కమ్ జనరేషన్ సోర్స్ కింద కూడా గ్రాస్ రూట్ లెవెల్గా గవర్నమెంట్తో టైఅప్ అయ్యి గవర్నమెంట్ ద్వారా ఏవైతే స్కీమ్స్ ఉన్నాయో ఆ స్కీమ్స్ని యాక్సెస్ చేసుకునే విధంగా విమెన్ గ్రూప్స్ బాగా పనిచేస్తున్నాయి.
One of the key needs for federations is organizational development or OD programs. Through Voice, an enablement program in capacity building, Dhwani Foundation works with INP Plus to strengthen the organization across 10 core or recommended domains. The initiative includes creating a secretariat, building visibility, strengthening the brand, and member training programs towards achieving the strategic goals. Recently, guided by the Dhwani Foundation, INP Plus conducted a pilot study in Namakkal district of Tamil Nadu to understand the gaps in cancer awareness among PLHIV. Key findings: 50% of respondents were unaware of cancer risks among PLHIV. 90% couldn't recognize key cancer symptoms. 100% were unfamiliar with screening methods like biopsies or PET scans. But there is hope. INP Plus is changing this narrative.
And we are looking at now how we can sustain the treatment program as well as sustain the lives of people living with HIV, because it is a long term of medication, lifelong medication. We need to have a look at the complications very minutely so that people can stay healthy life.
Many like Selvam, Chandrakala, Nirmala have transformed from being patients to champions of the cause. They, along with INP Plus, are the carriers of hope for thousands of others.
And other part is we are having the major revised missions which we are focusing on 4 priorities. That was the programs which has been focused and it has been come into force. The first one was the HIV bill. Earlier it was an act, now it has been come as a HIV bill. It's a 2017 Prevention and Control Act. So we are trying to implement this across the 5 states. And at the same time, the second focus is to empower the people living with HIV/AIDS at the organization level and strengthening 300 leaders at the South state level areas. And otherwise, the government has provided us ART treatment and increased our lifespan, but at the same time, our economic standard of living also should be increased. So our present vision was to improve the standard of life. We are focusing 10,000 people across the 5 states. So these are the 4 missions which is focusing on the particularly available programs.
INP Plus is committed to ensuring effective implementation of the HIV P&C Act 2017, expanding economic opportunities for 10,000 PLHIV by 2028, advocating for integrated healthcare by merging HIV and National Health Mission or NHM policies, building leadership capacities for 300 member organization leaders. INP Plus is working towards a future where people living with HIV are treated with dignity, have access to quality healthcare, and are free from stigma. By strengthening communities, advocating for rights, and driving systemic change, INP Plus is proving that a more inclusive and compassionate society is possible.